Working as a co-parenting team. Fathers and co-parents play an important role in breastfeeding. Research has found that many women indicate their co-parent support was the #1 factor contributing to their breastfeeding success. If fathers or co-parents have a positive breastfeeding attitude, mothers are more likely to start breastfeeding and breastfeed for longer. Studies which have included co-parents in breastfeeding education programs have found that co-parents who have knowledge about breastfeeding are able to assist mothers in meeting their breastfeeding goals and overcome common problems. There are 5 important elements of working as a co-parenting team towards meeting breastfeeding goals. These include setting breastfeeding goals, sharing the responsibility, supporting each other, fathers or co-parents' involvement, and working as a team. How co-parents use these 5 elements towards meeting their breastfeeding goals will be discussed in this short video. We will hear from 2 co-parents discussing their experiences about working as a co-parenting team. Number 1, setting breastfeeding goals.
We decided to breastfeed early on in the pregnancy because of the important health benefits, mainly to the child. There's been a lot of studies that have shown that breastfeeding has dramatic improvements to the intelligence and physical well-being of the child. So we wanted the absolute best for our little one, and so breastfeeding was a natural choice.
I decided to breastfeed because obviously for the health benefits for the baby, also because of the convenience actually for the mother and the father, and it's just so easy in the nighttime and wherever you go just to have it always with you. So that was actually one of the big things for me too. I just always knew that I wanted to try breastfeeding. We discussed our breastfeeding goals. My goal was always to breastfeed for about a year before I went back to work. Took the full year of mat leave. I exclusively breastfed for the first 6 months. And then it remained a big part of her diet, even when we switched to solid foods at 6 months.
Kimberly and I worked together right from the start and trying to decide what our goals were for breastfeeding. It was something that was definitely important to the both of us. Definitely our goal was we wanted to do, what's in the best interest, I guess, for Alice to give her the best start possible in those early years. So it was definitely with some clear health benefits choosing to breastfeed.
As well, it was also a decision that we made just for an opportunity for me to develop a better bond with Alice, and also it is very convenient to do, and not having to worry about cleaning bottles and carting them around. It was, it was absolutely the decision that we're glad we made. So we made the decision to breastfeed exclusively for 6 months. From then, we're going to continue to breastfeed while introducing solids, and for the duration of while I'm at home on maternity leave. And then we're looking into possibility of combining work and breastfeeding.
Co-parents who discuss how long they would like their child breastfed for and set goals are more likely to meet these goals. Co-parents can discuss how long they plan to exclusively breastfeed for and how long they plan to breastfeed once solids are introduced around 6 months. Number 2, sharing the responsibility.
Me being physically there and being an active participant, I think made you feel easier. We're working together as a team and we're doing this together.
And we really shared the responsibility of breastfeeding.
Raising a child is a responsibility for both parents, and that's every aspect of child rearing is a responsibility of both parents. So from changing diapers to helping breastfeed, I feel it's as much my responsibility as it is Kristen's to make sure that it's done and done properly.
Co-parents often share the responsibility for meeting their children's growth and developmental needs. This includes infant feeding. Since breastfeeding is important to the health of mother and babies, breastfeeding is important to fathers and co-parents. Co-parents often work as a team, supporting one another in meeting their breastfeeding goals and working to overcome breastfeeding challenges. Number 3, breastfeeding support.
To help support the breastfeeding before our little Jessica was born, I went to all the breastfeeding classes. I tried to make sure I was up on the literature. I wanted to be as educated as possible about it, and that actually paid off in the end, because when the child is first born, we're both exhausted. Everyone's exhausted. Kristen couldn't remember everything that they had said at the prenatal classes, and so that's where I was able to help out by knowing all the same information. I was able to suggest, oh, well, they said this one thing, and that helped us in a few occasions, actually, where we were able to, especially when she was early on, she had trouble latching, and we were able to offer different tips.
Also, at the beginning, it was very important for me that Xander was with me during the breastfeedings at nighttime. He would come with me into the nursery and would, even he was actually just laying on the floor beside me. We were both exhausted, but it was just nice having him there for the emotional support. That was actually very important to me.
One of the most important things that Ben did was he really sort of shared the time and was supportive physically there. So passing Alice to me to breastfeed at various times throughout the day and the night sometimes, as well bringing me pillows, bringing me water, that sort of support that way.
Even helping out after the feed was over, I could then take Allison and do the burping, or if she needed a diaper change, then I felt like I was part of the process both from the start and the end.
Yeah, and sometimes even just sitting with me and kind of sharing that family time meant that it was a positive experience all around, so that I wasn't just sitting feeding her alone. The way that Ben paid attention to Alice's cues, and then she, when she was ready to eat, he would say to me, "Oh, I think she's hungry," and would bring her to me, which was great.
Yeah. And as Kimberly became more and more comfortable, like feeding Alice, and that was going well, then still being there sitting with her was a good time. It was a good quiet time and a calm time to be able to also talk about Alice and just anything that's been happening kind of throughout the day as well. Direct communication about what are some specific ways that I can help her, whether that's bringing her like some pillows, helping to make her comfortable, maybe taking care of the pets around the house, just kind of ensure there's a nice comfortable, quiet environment to help support having a good feed.
There are a number of ways fathers and co-parents can support breastfeeding. These include providing information and problem solving around challenges. This occurs when fathers and co-parents have knowledge about how breastfeeding works and where to get breastfeeding help in the community. Assisting with household and childcare tasks is another important form of support fathers and co-parents can provide. This allows mothers the time to focus on breastfeeding. Other types of support include providing emotional support and letting the mother know you value and appreciate that she is breastfeeding your baby. Mothers can also provide fathers and co-parents with support by involving them in the breastfeeding experience. Number 4, fathers and co-parents involvement.
It's been nice, coming home from work, and if Alice is having like an evening feed, I'll take her when the feed's over, and I can burp her and take her upstairs sort of for the nighttime bedtime routine. So maybe changing her diaper, and while she's there, that's a time for me to have good bonding time with her and to get to know her. So we'll sing songs and we'll have play and rocking her and comforting her while she's going to sleep. Has been a great way to be involved as well. Yeah, there's a lot I can do without actually feeding her. There was lots of opportunity for me to feel part of the process as well. Kind of checking on Kimberly to make sure that she felt comfortable, and just from what we had learned from our courses and resources, that Alice looked well positioned and looked like she was having a good latch and was drinking okay, and the other parts as well is helping to kind of keep track of everything. Like our midwife and the doctor as well had talked about tracking like diaper counts, like how many wet diapers and that sort of thing. So I was able to do that as well on a tracking sheet, which was really helpful for both of us to kind of stay on top of things.
I was so tired when we first came home as well from the hospital, so it was important to have Ben's help in getting that started off in a good way.
Yeah. I found from doing that, from the very beginning, then I was learning Alice's like feeding cues right away. If she started to kind of suck on my thumb, or or put her own hand in her mouth, I was starting to learn her feeding cues, and to be able to tell when she was getting hungry. And there were often times that I was bringing her to you and saying, I think she's definitely hungry.
The only advice I'd have for other fathers is to be involved. It's a great experience. Spending any time with your child is a gift. So make sure you are educated as much as you can be to make sure that you have as much effective time with that child as possible. And that can include helping to breastfeed her, which is a wonderful experience.
Fathers and co-parents need time to bond with and get to know their breastfed babies. There are a number of ways fathers and co-parents can spend time caring for their babies, which does not involve feeding. By spending time with their babies, fathers and co-parents are able to learn about their baby's likes and dislikes and how to calm them when they are fussy. These interactions will help build the relationship and fathers and co-parents' confidence in their parenting skills. Number 5. Working as a co-parenting team.
Xander and I are actually a very good team, I think.
Absolutely.
We actually had to do a lot of problem solving in the beginning because of my complications with the recovery and also with her tongue tie. We had to look at a lot of literature. We went to a lactation consultant together. All the appointments, he always accompanied me to our family doctors. He went with me. We did a lot of research into fixing things, and we really did actually manage to breastfeed her together. It is a very tiring experience. It's a very beautiful and joyous experience, of course, but it is very exhausting. It's important to work together as a team. It's such a great bonding experience between the baby and the mother, but also for the father in there too. It was a team effort. Even now, she's almost 9 months. It's still actually hard to find the time to communicate, especially working long hours and commuting. And we try to carve out that time for each other. So when she goes down for her sleeps, her nap, and that we make time, that we make sure that we do communicate.
Kristen and I have always been very open communicators, and I think that has been critical in the breastfeeding experience because I'd check in on her and she would check in on me to make sure that I was feeling a part of the experience and that I was getting enough time with little Jessica, and that would make sure that she was breastfeeding successfully and not having any issues and didn't need any additional help.
I think it's also important to always keep up communication between each other and always remember, to see the humor in things. We actually laughed a lot in the beginning. We had actually a lot of fun. Even through all the exhaustion and the pain and all that other stuff, I actually remember that it was very fun and just experiencing her and learning about everything and, just really enjoying that time of our lives.
We kind of checked in and communicated about the challenges that we faced kind of along the way. The transition to parenthood has been very exciting, but trying at times. And one way that we've been able to work through it is by really making sure that we took time to communicate. With so many new things happening, in our family and with me, it was important to just carve out time to actually explain how I was feeling because it was new to me and there's no way that Ben could have known how I was feeling. So we definitely made sure that we tried to express the new feelings we were having to one another so that we could support each other and understand.
It was new to me as well, so it was nice knowing that Kimberly would be very open and honest and at times give me a little bit of direct communication about what are some specific ways that I can help her.
When co-parents work as a team, they are able to support each other in meeting their goals. Important skills used in teamwork include effective communication, problem solving, and conflict management. Co-parents often find the early days of parenthood busy, tiring, and hectic, and it can become difficult to find time to communicate and let each other know how they are feeling. If problems are not dealt with, they can become bigger and lead to conflicts. It is important for co-parents to communicate and problem solve in order to meet their goals. Working as a team is important to breastfeeding success. Fathers and co-parents play an important role in working with breastfeeding mothers towards meeting their goals. Supporting each other and using open communication can help make breastfeeding a positive experience for the whole family.